Welcome to PhocusWire Pulse, Safer and Seamless. Please welcome Kevin May, the Editor-in-Chief of PhocusWire.
A very warm welcome to you to PhocusWire's first Pulse event here on February the 23rd. This is the first in what we are planning to be a regular series of mini online events from PhocusWire, complementing the large conferences that our sister brand Focusrite produces in Europe in June and in the US in November. The aim of the Pulse events is to concentrate on a particular subject and dissect it through a series of interviews with thought leaders and industry executives. We can actually announce today that the next Pulse event will be on March the 23rd and will be titled Loyalty for the Long Haul. You can probably guess what that topic will be covering. But anyway, back to today's Pulse. Almost a year ago to the day, I was at the Travel Technology Exhibition in London with some of my colleagues that you'll see today after me. And I'm sure many of you were there that are tuning in today. It actually seems bizarre now that at the time we were still wondering if the ITB event in Berlin was going to take place the following week, and if the Easter holidays that many of us had planned might be impacted by the outbreak. But, you know, here we are 12 months on, and our industry has been hit harder by the coronavirus pandemic than perhaps any other. We all know the figures, and many of us are still grappling with the consequences of that near total shutdown over the course of last year. But arguably, many aspects of how this sector operates will actually never be the same again, for better or for worse. Whether it's regulatory and hygiene related conditions that are or will be imposed on travellers as the industry recovers, or just a sense that we as an industry can perhaps do things better. Providing services in a safer and seamless way is part of our future. Which brings me nicely to our Pulse event called, you guessed it, Safer and Seamless. Today we are focusing on one of the most important elements of the industry's efforts to recover and restart due to the impact of the COVID-19 pandemic. We're going to explore a range of issues that every business in the sector is experiencing here in early 2021, including understanding health and vaccine trends, technology provision for welcoming back customers, changes to business practices, and the implementation of new processes for customers and our staff. We will also look at how the industry is attempting to work with governments and representative organisations to mobilise customers and ensure recovery is implemented as safely, seamlessly, and efficiently as possible. So, our agenda today, as you can see on our screen, first of all, in a few minutes, I'll be talking to Gloria Guevara. She's the CEO and President of the World Travel and Tourism Council. We'll then hear from Alan Murray-Hayden of IATA in conversation with my colleague Linda Fox to get some perspective from the aviation sector. Our news editor, Jill Menz, gets handed the baton to discuss with Opti CEO Catherine Grass about how hoteliers are working towards a tech-led and safer environment for guests and staff. Unfortunately, you get me again for a chat with Florian Kramer. He's the Professor of Vaccinology at the Mount Sinai Medical Center of New York City. I suspect he's probably the most qualified person at this event today on such matters. And then we get the first of two interviews by my comrade Mitra Sorrells, who will be up after that. She's talking to Clive Book of Dayon, which is the provider of the Verifly app, which many of you will have heard of. Linda Fox returns to talk to Brandon Balcom of CWT about the world that business travel now finds itself in. Then Mitra Sorrells is back again to tie things up and give us a big picture overview of the challenges and opportunities that the industry is working through now by talking to Terry Jones of Travelocity and Kayak fame. Finally, my boss and the managing director of Focusrite, that's Pete Como, will briefly wrap things up for us and send us on our way. So that's your next 2 hours or so lined up nicely ahead of us. Bit of housekeeping, really. My sincere thanks to all our guests today for agreeing to participate. We know you're all in the deep of the weeds, dragging the industry through this crazy time and are very busy. So we're very grateful for your time today. Thanks also to the editorial team at PhocusWire for their interviews today. And in particular, I'd like to say publicly for their hard work and commitment to the cause over the last 12 months. You make me very, very proud for what we do here at PhocusWire. Also, thanks to my colleagues behind the scenes at Focusrite for getting these events up and running, especially Jean Coe, who's our producer, who's making sure we all look and sound terrific. And I'm guessing, sincerely hoping that we start and finish on time. And finally, of course, my huge thanks to all of you for tuning in today. We hope what you see and hear is both thought-provoking and useful to you in your businesses. So, right, let's get things started.
And now please welcome Gloria Guevara, the CEO and President of WTTC.
Gloria, hi. Thanks ever so much for joining us on PhocusWire's first Pulse event. I think a very important person. Oh, you're very welcome. I think a very important person to have to kind of kick things off for us today, just because WTTC is a very prominent organization in the way the industry operates. It's a commercial organization, has lots of industry members. But we thought it would be good to talk to you, first of all, to just kind of give us a really good overview of where the industry is at the moment and some of the work that you've been doing behind the scenes, both publicly and privately, to get things going again, and then kind of dive into some of the issues there. So first of all, I mean, just briefly, if you can, Gloria, just kind of give us a sense of where the industry is now, the impact of the last 12 months on it, maybe some figures that you can give us, impact on GDP, all those kind of things, first of all.
Well, thank you for having me. As we know, WTTC was created 30 years ago to quantify the economic impact of our sector. In 2019, when we released our numbers, we published that 10% of the global GDP, that was the contribution of travel and tourism, 330 million jobs around the world, which is 1 in 10 dependent on travel and tourism globally. As you mentioned, this was the worst crisis ever. Just to give you an idea, the global impact as of the end of 2020, it was estimated to be 174 million jobs impacted globally and $4.5 trillion or $4,500 billion. So that is totally unprecedented. And when we say jobs impacted, that includes jobs lost, or that includes jobs in furlough that might be lost in the near term. 80% are SMEs. And of course, as we know, 54% in our sector, women, 30% youth. So it has been devastating for everyone.
Okay. So the figures that we've heard a lot, and as you say, they're devastating, and we're not really quite sure really how the next few months are going to unravel. However, there must be some kind of planning in terms of recovery scenarios that you are working through at the moment as an organization and with your member companies. Can you talk us through some of those?
Yes, you're absolutely right. We estimated a couple of scenarios, and according to those scenarios, this year we can bring back between 88 million jobs and 111. So it's an average of 100 million jobs out of the 174 already impacted. But in order to bring back those jobs, certain conditions, they need to happen. And that's why the advocacy work that we do with governments is crucial, because we speak with one voice and we're trying to work with governments to implement the policies that are needed to resume mobility, especially international mobility that is related to international travel. If we have the policies in place that they are required, we believe that we can have a strong recovery starting in April, and of course, a strong summer, as long as we have this collaboration that is needed among countries and also with the private sector.
Certainly where I am here in the UK, there's been a lot of excitement. I think you're based in here in the UK as well, aren't you? There's been a lot of excitement over the last 24 hours about, the end of lockdown, and here's the time to start thinking about your summer holidays. I believe, Gloria, it was back in either September or October, there was WTTC was saying that it was close to having some kind of coordinated efforts amongst your members and governments, whether that was multiple numbers of governments. Can you give us a kind of an update on what that collaboration has come to yet, or what your kind of vision is for that?
Yes, back in October, we had the chance to participate in the G20. This was the first time ever that the private sector is invited to join to this platform. WTTC has been participating for years, but never we had CEOs to be part of this session. Why the importance of the G20? Because when you look at these 20 countries, it's very complicated to get the international collaboration in 100 and plus countries around the world. But at least if we can get these 20, that will cover for a big portion of the world, and it will be a domino effect. So we presented in this very important meeting a plan that it was requested by Saudi Arabia. Saudi Arabia, by the way, was the presidency of the G20 last year. We presented a plan to recover 100 million jobs that included 12 commitments from the private sector that we have executed so far, and 12 things that we needed from the governments. Some governments have been very proactive and accomplished and executed all the 12 commitments, but unfortunately not all of the governments. So we're a little bit behind in that plan. We created a task force where our CEOs meet frequently and review the progress. And some of the things, for instance, what we still have to work on is the interoperability on the digital apps that we have around the world for the digital passes, as an example. Right now, we have so many solutions that they don't talk to each other, and that creates more problems with government. So we need to have that framework and interoperability that is needed. But overall, we are feeling more comfortable, more confident. We're finally moving in the right direction. We're also working with governments in Europe, the G7, of course, and also OECD that is helping us for the protocols needed for the mobility. And when I say protocols, are the rules, so that we can have certainty next time that you travel out of London, you know exactly what's expected from you, depending on the country that you're visiting, and also what's needed in your way back.
Would you say, finally, on this kind of the government collaboration question, would you say it's been an easy task, if such a thing can be an easy task, but by which I mean, you know, coordination and even just getting access to the right people, and indeed coming up with a unified voice, or has it been quite challenging? Because I would imagine many countries have got maybe different scenarios of their own that they want to kind of work through in this kind of recovery period.
That is a great question, Kevin. And the reality is that a WTTC crisis has been a priority since I recall. And we analyze a lot of situations, 90 situations in the last 20 years to learn from the past. And I can tell you without a doubt that the biggest challenge that we had last year was the lack of, or the poor coordination among countries, the lack of sharing of best practices, the lack of interaction. Every country, for obvious reason, was looking just for their own citizens, which we understand. But at the same time, when someone else is doing a better job in a specific area, there's an opportunity to do best practice sharing. We have tried to cover the gap, sharing some policies from some countries to others. But I can tell you the greatest challenge has been the lack of international collaboration. And that has slowed the recovery, that has impacted the outbreak. And of course, because countries were doing different things and trying to test as they went. And I don't blame them, because there were a lot of unknowns. But at the same time, we didn't have that leadership needed to step up and try to bring that coordination. And that's what the G20 was a crucial platform for us.
Gloria, can we talk about COVID passports? There's, I don't want to continue bringing up what's going on at a political level here in the UK, but it's obviously front of mind. I mean, there's some considerable debate here about the COVID passports, or and how that might work. I mean, do you have a WTTC view, or how you see that kind of playing out?
We do, and that's another great question, because there is a lot of confusion between a passport and a pass. And let me just clarify that, and I'll tell you what's the position from WTTC. First of all, a health passport includes all your information, all your vaccinations, including chickenpox, whatever vaccinations you have had through your life. We don't believe that health passports are needed to travel. Now, in the case of COVID, we need digital passes or health passes that sometimes are confused with passports. A health pass is just for one time. That could be a health pass for a test in case that you needed a test to travel. The health pass in a digital app would say that you tested negative or positive and you're not allowed to travel. Now, if you have a vaccine, hopefully in the future, the health pass will say that you have been vaccinated. However, that doesn't seem that is going to be the only requirement, because more and more the public health experts are telling us that you can be vaccinated, but that doesn't guarantee that you're not spreading the virus. So we need to be very careful there also, and thinking that requesting vaccination as a requirement to travel is enough. We are not in favor of vaccination as a requirement. We believe that, yes, vaccination is great. The UK has done an amazing job in the rollout, and also many countries in Europe and North America. But at the same time, we need to very aggressive continue with testing, low-cost tests with high efficacy, so that we can make the invisible visible and isolate the people infected, so that we can resume mobility and have this seamless and safe experience.
Where do you, as you may have heard in my introduction there, we've got a professor of vaccinology coming up in about an hour, who's very heavily involved in antibody testing as a mechanism for, rather than a vaccine passport or a stamp like that. I mean, where do you sit on something on, do you see that as part of the testing requirement that you just referenced, or do you see that as something else? So it's antibody testing.
Well, according to the conversations, and we work with so many experts around the world, including CDC, WHO, and of course, Harvard School of Public Health. And my understanding is that antibody test is not enough. We need to be able to know if you have COVID or yes or not. An antibody will tell me if you had past tense COVID, right? And if you had the antibodies. Now, that being said, there are some cases of people that have had COVID twice or 3 times. So from our perspective, as I said before, we need to be able to identify the people infected. And this is a lesson from the past. We were able to travel after SARS, after Ebola, without a vaccine, because we were able in the past to isolate the people infected. Yes, here we have a lot of asymptomatics, and that's why testing is crucial. But in our mind, it's testing for COVID. If you're sick, if you have COVID, you should not be allowed to travel. And in that case, you should be sent to quarantine. However, if you're healthy, you don't have COVID, you should have your freedom, you should have the mobility and clear rules in order for you, your loved ones, your friends to be able to move around and travel around the world with the guarantee that who is traveling with you in the same flight or the same train has also tested negative. So we can include testing as part of the seamless and safe experience before departure, and testing for the virus, not for the antibodies. That's what the experts are telling us.
Okay. Again, recently in the UK, just a week ago, which seems quite strange given that we are almost a year into this, we had a quarantine system for arrivals here put in place in the UK. I mean, that's a fairly uncoordinated pattern. So some countries do have the quarantine system in place and some others don't. What's the kind of perspective that you have on that? Because it does seem like that kind of uncoordinated program or very random program around different countries is perhaps not conducive to some kind of wholesale effort to get the industry moving again. Would you agree?
I totally agree. The quarantines are assuming, for instance, the quarantines that we have here in the UK are assuming that everyone is infected. And yes, you might have 100 people arriving and only one tested positive. You should put that individual in quarantine, but not the other 99. There is not enough evidence that the quarantines work and they impact mobility. So I think it's cheaper to invest in testing, contact tracing, and use the technology to isolate people infected. There's a lot of technology and solutions available. I have seen some solutions where you can use your phone, for instance, to download an app to detect through your voice if someone has COVID or not. There are solutions where you go through a screening and they check the airborne particles and they know that you have COVID or not. There's so many solutions out there, and it's cheaper to invest in those solutions in order to resume mobility. Now, that being said, the quarantines are pretty much saying you are not welcome to the country. And for the countries that have imposed quarantines, for the countries that have impacted mobility, those are the countries that last year they had the greater loss in GDP. And there are a lot of examples of countries that have got this better or right, and the countries that have done it, like the hotel quarantines, that honestly, I don't see a clear exit strategy, and the impact is significant, and the livelihoods impacted have been significant.
You said something right at the beginning of our conversation, Gloria. You were talking about the interoperability of all the different mobile applications, and you referenced a range of different technologies. The interoperability of this is going to be key, but also perhaps the biggest challenge. So how does the industry or WTTC help kind of either coordinate or get over this hurdle around interoperability?
There are a lot of great applications that have been developed, and currently we're championing an initiative where we're working with all. You have, for instance, the Common Pass that is being championed by the web. You have the IATA Pass. You have the AOK Pass from ICC. There are like 20 different apps. The challenge is, as I say, they don't work together, and that needs to be that's crucial, because governments are going to probably recommend one versus the other. Airlines will recommend one versus the other. And it's going to be a nightmare for the traveler and for governments if we have so many and they don't connect. So there is an initiative in place that we're working with the WEF, with IATA, with ICC and many others, bringing everyone together, IBM, Google, everyone, and of course the GDSs, to create this interoperability and the trusted framework so that it's easier for the consumer, for the traveler, and for the governments. And for you, it's seamless. We need to make it easier for the travelers, but at the same time, be able to show if you tested negative in your app so that it's totally touchless and it's a seamless experience and not more complicated that you need to download 5 or 6 apps in a journey.
Right. And finally, if we can, I mean, we've talked a lot about government collaboration and provision of technology already and various other elements. What would you say, if anything, perhaps you may have identified around these changes and things that are coming in that you might actually see as being long lasting and ultimately beneficial to the kind of the traveling experience, even if, as we hope, this pandemic does kind of go away and things return to normal? What do you think is going to be long lasting for us?
Well, let me just tell you 3 things. First of all, we need to learn to coexist with this virus. If someone is thinking that everything is going to go back to where we were in 2019, that's wrong. We are moving forward with an accelerated digital agenda, accelerated sustainability agenda. We need to think forward. Now, that means that we need to learn to coexist with the virus for some time, which means that some protocols that have been implemented, they'll stay longer. For instance, you will see a lot of screening in airports, like monitors checking your temperature. You will see whenever you go to security, perhaps those kiosks to check right now for explosives, they will be checking for virus as well. You will see some sanitizing procedures in place that they'll stay for good. So you will see some things in your experience overall that will be implemented for long term. Now, are we going to see wearing the mask forever? No, but we will see wearing the mask at least for this year, I have to say. And perhaps for international travel, long haul in the future in some parts of the world. As before COVID, we were seeing that in Asia, who had 11 outbreaks in the past, and they had more experience than, of course, this part of the world. So you will see also a lot of touchless, a lot of use of biometrics, a lot of use of applications to have your data, your information more seamless. As I say, the agenda has been accelerated, and some countries were planning to implement biometrics in 3 to 5 years. Now it seems that if you don't have it, you're in a competitive disadvantage. So you will see more seamless, touchless, accelerated, as I said, that agenda, and some of the protocols will stay. They are not going to go away, and we just have to embrace it and learn to coexist with this and move on and have the mobility that we are all missing.
Yeah, indeed. I remember reading a report last year that said, the acceleration of the digitalization of both culture and business advanced more in 5 months last year than it had done in the previous 5 years. So plenty to think about. Thank you so much for joining us, Gloria Guevara from WTTC. Really appreciate your time. Next up, we're going to hear from how the aviation world is hearing with our speaker from IATA. Gloria, thanks so much ever so again.
Thank you. Thank you, Kevin. Bye.
Up next, how aviation can help lead the industry's recovery, featuring Alan Murray Hayden, head airport passenger and security products at IATA, interviewed by senior reporter of PhocusWire, Linda Fox.
Hi, everyone. Thanks again, Kevin and Gloria, for that great session. Gave us a really good pressing of the state of play with travel at the moment. Alan, perhaps you could give us a similar kind of overview of efforts from the aviation industry to get to travel back again.
Okay. Okay. Can you hear me okay?
Absolutely.
Okay, perfect. Hello, everybody. IATA does 3 main things. We represent, serve, and lead the industry. There's 3 main areas of activity. One is through advocacy. So we're obviously doing a huge amount of work with governments around the world, trying to promote the safe reopening of the aviation industry. The second area is we work on standards, and I think it was very interesting to hear some of what Gloria was saying earlier on. And that's really what we need in this area is standards in terms of exchanging data both from health providers and also across the industry. And then the third area where we work in is solutions. And there's a number of different solutions out there which IATA is developing, be it from a rules database, which we've already been doing for the last 60 years, the whole way through to a mobile application, which will effectively enable airlines to open up safe travel again. So there's a whole range of solutions, a whole range of initiatives in those three areas.
Do you think airlines are finally getting through to government now in terms of, what needs to happen?
I think the jury's still out on that one, to be perfectly honest. If you look at what's happened over the last couple of months, I think it's fair to say the government's been blindsided in many cases. You see what happened with vaccination. It was as if they hadn't, many of them didn't realize it was coming down the road, with the exception of the UK, obviously one should point out, and Israel, who's done an absolutely fantastic job. You now see it from our perspective, governments need to start planning for the reopening of travel again. And that's not something which currently seems to be on the agenda very much. I do think it's very much on the agenda of the ordinary person on the street, but what we don't see is a similar action coming from governments at the moment.
Now, it's going to take an enormous piece of collaboration, something that Gloria also mentioned. Is that something that you're beginning to see? It's not something the industry's been particularly good at in the past.
I wouldn't necessarily agree with you there. I think the industry has been incredibly good at collaboration over the years. I mean, IATA is made up of 292 airlines, all of which completely interoperable systems. So you can book on one airline and fly another. You can check in for one flight on multiple carriers, checking for multiple carriers with one flight. And so I think the industry is extremely coordinated. And I actually think the industry has done a fabulous job over the last year. I mean, our industry and airlines have been suffering greatly, hugely. But if you look at how they've all been working together in terms of lobbying governments and working together with on the IATA Travel Pass and other initiatives, I think they're actually doing a very good job given the really difficult situation facing all of them.
So, again, something that Gloria mentions, we do have these various passes now. IATA has one. Now, how are we going to get something cohesive and coordinated so that we can move forward from here? Because it seems still very much a very bitty approach.
This comes back to the whole point which was raised earlier on about interoperability, which quite frankly, I think is a bit of a red herring. Everybody keeps saying that all the different solutions out there need to work with one another. And yeah, it would be good if they could, but in reality, they don't. Because from our perspective, IATA is not out there trying to create the IATA Travel Pass. We don't believe that that's the long-term solution. What passengers want to do is they want to do this within the airline's own applications. So for example, I fly all the time with KLM and EasyJet. Those are the two apps I have on my phone. I buy my flights on them, I check in with them, I select my seat, and in the future, I'm going to prove my identification, and I'm going to share my COVID test and vaccine results. So why exactly would we need to have multiple passes all speaking to one another to make that happen? So I actually don't think that's the key issue here. The key issue is the interfaces and the standards between all the different systems. So for example, if one airline was to introduce IATA Travel Pass and another airline was to choose one of the other passes to integrate into their system, those interfaces into the airline system should all be standardized. Therefore, the airline can basically swap one provider out for the other. So those interfaces between all the different industry systems, that's where we need standards. The interoperability between the passes, it's not of great importance for us.
And yet it's something that everyone is stressing. So why is that then?
I think, I don't want to speak for all the other solutions on the market, but I think some of them generally, they're trying to create a brand and a solution which is unique and standing by itself. Whereas on the other hand, the IATA Travel Pass is completely focused in on serving the needs of the airlines. So we're not about building the IATA Travel Pass brand. We're about integrating it into airlines' own systems and passenger systems, so passengers get a completely unique experience.
So how does an airline then go about choosing from, your sort of more, I guess, B2B system to another of those out there? What would be the decision-making process there?
I think airlines are being very, very very clever about this, and I think they're approaching it the right way. So we're working with about 50 different airlines at the moment, and most of the big ones, nearly all of them will be piloting with one or two different solutions. So what airlines, they're choosing the two, maybe two, even three, which they think are the best ones. They're piloting them, and I think based on the success of those pilots, I suspect the airlines will just choose one and say that's the vendor we want to go with going forward.
Gloria mentioned something there about maybe governments forcing airlines to choose one, or perhaps governments choosing one themselves. Do you see that?
I think governments may force passengers to use their own application, but I would be very surprised if governments try to endorse passengers to use one particular application. We saw that happen in the US earlier this year in terms of contract tracing, and flatly it just didn't work. You can't force. You can force passengers into using a government system, but not into using systems from private organizations.
Now, there's a whole kind of almost elephant in the room here, and that would be the privacy of individuals on their health information. How are we going to get customers back, customers who are confident about traveling, but actually might be worried about handing off their personal data?
It's an absolutely excellent question. The key thing, the key way the IATA system has been developed, and then I'll get on to the other ways afterwards, is what we call decentralized identity. What that means is the passenger creates their digital passport, their digital ID on their phone, and then they receive their test results on their phone as what we call a verifiable credential. The passengers are then prompted to share that data with airlines or governments. And they can do it, and if they choose to do so, then it gets sent to airlines or governments. What's absolutely key is that there is no central IATA database. The data stays in the passenger's phone until they share it with the governments. The alternative option to that, which we chose not to go down the route of, is where you have a big centralized database where all of the data is moved to that central database, and then that gets shared with the airlines. That's something which we've been working this whole area for a number of years, 3-4 years, and IATA's got very strong principles that in the future passenger data should stay with passengers and be shared directly to governments ultimately.
And do you think that's doable? I mean, I see, for example, that your app may be ready quite soon. I think there's a date in March. Is this doable in the next sort of 2 months, 2-3 months?
Oh, absolutely. We're actually currently just finalizing the last tests for the pilot version, which will be launched it'll be launched mid-March. In effect, it needs to be ready in the next week for us to make it available to the market in mid-March, and then we'll be launching the full solution later in March. What's important to note is that we've been working on this for December for this particular application, but the whole area of decentralized identities and using blockchain and blockchain systems to power this type of solution, we've been working on that for well over a year at this point. So what we've done in the last couple of months is actually focus it to try and help us solve the problems we have with COVID at the moment.
So IATA might be ready, and some of the other health pass developers might be ready, and airlines have been champing at the bit to get back in the air. But what about government? How do we get them along?
Yeah, I get asked this all the time. One of the key points is that governments have a role to play in this, but not an immediate role. If you look at the IATA Travel Pass, it enables passengers to create a digital version of their ID, receive the test results, verify using industry system called Tematic that those test results meet the destination requirements, and then share it with airlines. It's then up to the airlines to receive that data and say, yes, this passenger is properly documented, and then they allow the passenger to travel. But that is the exact same process we've had for the last 50 years. It's up to the airlines to check that the passengers are properly documented. And then if they carry somebody who isn't properly documented, that's when the government step in. Now, ultimately, what we would like to achieve in the future, and this goes for identity as well as COVID test results, is to establish a relationship between the passengers and the governments. So that's the long-term goal. The passengers send their data directly to the governments, and governments give the airlines an okay to travel. Quite frankly, airlines do not want to be in the business of collecting passenger data. So it's ridiculous that we're collecting passengers' passport data and then passing it on to the governments. It's a much healthier ecosystem if passengers deal directly with governments and airlines fly passengers.
But we're already having noises from government saying, I think it was Johnson this morning saying that he's going to have a relook at the whole idea of health passports. So inevitably, they are going to get involved, aren't they?
Yeah, and there's a couple of key things. which we're looking for. In the medium term, one of the key points is that we want governments to start issuing digital proof of vaccination. So this is another huge area which governments need to work on. Let's say every single person in the United Kingdom was vaccinated. Quite frankly, that wouldn't be sufficient. Passengers need to be able to prove this electronically. And just to give you an example, at the moment, airlines are currently carrying about 5 to 10% of the normal passenger volumes, but they have the same number of check-in agents processing them at the airport. So even if we wanted to carry double, triple the number of passengers today, we couldn't based on paper vaccination certificates. So if governments want to open up aviation, and not just aviation, but the economy in general, they need to be issuing their citizens with digital proof of vaccination. And then passengers can then use that to prove that they're vaccinated, and they can get back to traveling and going to football and rugby games and anything which involves a mass gathering of people. So there is a key role for governments there in the medium term in the issuance of digital proof of vaccination.
Is there a question of who pays as we go forward for, the digital development?
I wouldn't have thought so. If you think about it, the amount of money which is being pumped into the economy, I mean, billions, trillions, in many countries. If you have to spend a bit of money giving everybody access to digital proof of vaccination, I think it will be a very, very small price to pay. It's a little bit about like the price of the vaccination itself. If everybody needs to be vaccinated, it's what, $10 or £10 a shot. You're talking about 50 million people in the UK. It's $500 million. Compared to the rest of the cost, it's nothing. And I think it's the exact same with proof of vaccination.
Now, if we look at some of the technology that's being developed and kind of hopefully more joined up in terms of the passenger experience, what do you think out of those developments are here to stay? And I don't mean sort of PCR testing or health passports. I mean more of the passenger experience side.
Another really good question. There's two elements to what we've done, and I think what some of the other providers are doing. You've got the COVID element, and hopefully that will be gone in a year or two. Let's say 2 years' time, we've all been vaccinated and COVID has hopefully gone away. And then the second area is the digital identity. And that is absolutely going to be the game changer in the future in terms of aviation. And what that does, it enables the passenger to create a digital version of their passport on their mobile phone. And that's something which can be done today. All the technology is in place. And that's something our app will do. And what that means is the passenger has a digital version of their passport on their phone, which is linked to their selfie, which they take. The passenger then shares that with the airlines, airports, and governments before they arrive or before they go to the airport for their flight. And that means that they can be processed at the airport simply by looking at cameras. So if you can imagine in the future, and I'm not talking about a long time in the future, some airports were already implementing this type of technology before COVID hit. But the idea is you arrive at the airport, you step out of your car, you walk up to the bag drop, it recognizes you and spits out a bag tab. You do self-bag drop. You go towards security, and rather than handing your passport over or your boarding pass over, you simply look at a screen and continue. You then go to the immigration line, you look at a camera, they've got your data already, and they say, yeah, Alan is fine, good to go. And it goes the whole way through to the self-boarding gates. So in the future, everybody will be processed using their biometrics, which is absolutely fabulous because it means you can basically get from your car the whole way to the plane without having to physically show your passport or exchange documents. And
I'm hoping that we'd have gotten over some of the privacy issues by then as we go forward. So one kind of final thing. Sorry, go ahead.
Yeah, do bear in mind that passengers are sharing all of this data with governments and airlines already. So there is nothing new in terms of data sharing. The only thing we're doing here is we're making it much more safe and much more efficient. So there's nothing new in terms of data privacy here.
Okay, so just one kind of final thing. Given that we're kind of hopefully coming out the other side of COVID now, do you see a future change in the way airports are designed and how obviously you've just talked about how we might move through them. So does that mean a fundamental change in how they're designed?
I think yes and no. I think airports will pretty much stay the way they are at the moment, but the big difference will be the biometric processing. So the idea that you'll walk through the airport space purely on your face, which will require the implementation of all different new infrastructure. That being said, just like the vaccinations, it's not particularly expensive infrastructure. So yeah, airlines are going to need to invest, but what it'll mean is they'll be able to get more passengers through the airport. So the average cost should actually go down for airlines and passengers.
I suppose I was thinking that if we can almost arrive at the airport already checked in and almost all the gates open for us as we move through, that perhaps we won't need such huge kind of airport, airside and landside, because there won't be the queues, there won't be those other kind of challenges.
Yeah, and I think again that particular area is not my area of expertise, but I think it stands to logic that if we can get out of our car and walk the whole way through to the boarding gate, airports will probably look a little bit different. A lot of the airports are designed around retail and around bars and restaurants, because passengers need to be set there so far in advance. So if they don't need to be there so far in advance and can walk the whole way through, you probably will see a change in the design of airports. Again, that's just purely from a personal perspective, just using my common sense.
No, great, Alan. Thanks for your thoughts. It's been really good to talk to you. Now, stay tuned, everyone. Coming up is my colleague Jill. She's going to be speaking to Catherine Grass on the accommodation segment and COVID. Thank you very much.
Thank you.
Up next, the Accommodation Playbook for a Smarter Future, featuring Catherine Grass, the CEO of Opti, interviewed by Jill Menz, the news editor of PhocusWire.
All right, so we just heard about recovery in aviation from Linda and Alan, and now we're turning the focus to hospitality and the Accommodation Playbook for a Smarter Future. And joining me to talk about this today, we have Catherine Grass, who is CEO of Opti Solutions, as well as a venture partner at Thayer Ventures. Catherine, thank you so much for joining us today.
Thank you for having me. Good morning.
Good morning. So I want to start with this idea of a playbook. Last May, Opti introduced a playbook designed to help hotels confront the challenges brought on by COVID. Now that we're in 2021, what does that playbook look like as it relates to recovery?
Yeah, we were quick to implement the playbook, as you mentioned, about a year ago. What could you do differently? How do you remove stayover cleans from the hotels? How do you audit trace new protocols that are being introduced? And how do you do all of that, smarter, better, seamless, without a lot of workarounds on the ground? And I think the playbook now continues to, how do you develop flexibility? Flexibility is absolutely the name of the game in 2020 and 2021. And how do you make things simple and easy to use? I think this ease of use was an issue even in the best of times. It continues to be a critical component now in hotels. I think hotels have minimal staff levels. They have rotating staff. They've always had that. So how easy are your solutions to use? How easy are they to onboard? And is it giving you that flexibility to make and adapt to changes that you're going to have to do on a daily, weekly basis to help you do more with less, and not just do more with less, but do better with less, and not try to fight kind of against the solution to find these funky workarounds.
Right. Yeah, you mentioned doing more with less, and technology is a big component of doing more with less. And I think a lot of hotels know the benefits of becoming safer and seamless. They see that, but what are some of the biggest challenges in actually implementing a tech-focused solution? And what should they be thinking about prioritizing for, say, your 50-bed hotel? What should your priorities be?
Yeah, I think some of the cleaning protocols are settling down. And I think the best way to make impacts the best way to cause impact and to drive value is to really understand what you're doing and the impact that it has. So how can you measure that impact? Are you doing things that save you time and save you money? And when you make changes, and even when you remove things, you think by removing processes, removing steps, that you're ultimately saving money. And sometimes that's not the case. So are you able to make a change and measure its impact? Even measure, understand the downstream impacts of that, and can that solution help you make those smarter choices, or maybe try one or two different ways of how to do things and see what the impacts are. So I think that, again, it goes back to that flexibility and the ability to measure and understand the information and the data of the decisions that you're making to make sure you're making the best choices.
Yeah, and I'm curious on the flip side of that, have you seen hotels in this COVID period maybe not make the smartest investments, where they think they need some solution for something, it turns out they don't? Have you seen any of that at all?
Well, for sure, we've seen trial and error, and that's understandable, right? We're all trying to figure this out. We're still trying to figure it out. I would say I think when we think of seamless and contactless, I think that also, to me, means smarter, right? So hotels, many race to make interactions contactless. But sometimes those contactless interactions weren't necessarily seamless. And for those of us who've maybe stayed in a hotel recently, I think an example of that are how some hotels have implemented chat solutions to be contactless interacting with the guests. But some of those chat solutions on the back end require staff to actually chat back. And staff are at such minimal levels already in the hotels that guests are trying to chat and ask a question, but they're actually not getting a response back. So that's just one example of a solution that we have to be cautious of, that when we implement these, even though they seem contactless, are they smarter? Are they efficient? And to understand the implementation impact and kind of the follow through of any solution that you're introducing.
I want to dig into the touchless and the contactless bit of more around cleaning specifically. How should hotels be thinking about cleanliness and hygiene? Is it about disinfecting? Is it about social distance? Is it about air circulation and quality? Turnover time per room? How should they really be thinking about that, and also making those protocols efficient?
Yeah. So I think that on the cleaning protocols, I think it's settling down a little bit. At the very beginning, we didn't know, how necessarily COVID was being transmitted. We didn't have maybe the best way to audit, trace even what was happening, to be able to ensure that what we do wasn't creating any issues. And so as that starts to settle down a bit and we understand, I think the hotels are doing a better job of not only implementing their cleaning protocols very much around, I think, the airborne side, and making sure that the distance is there, making sure that there's signage up about only one family or guest in the elevators at a time, or maintaining more outdoor seating or spaces within the lobby, but also able to measure those impacts of the cleaning protocols that they're doing, and being able to audit trace if there ever is a problem. So, and it's not just about the things that they are changing and eliminating, but again, trying to understand what the downstream impacts of those. And I think maybe a clear example that we've seen, a lot of hotels are still in the US, not globally, have eliminated stay-over cleans. That was really just to reduce contact in the rooms. That was also because of reducing staff on site. And now what some of the hotels are seeing is that's impacting the guest experience. If the guest's not in the room, that they would prefer some sort of service. And because if you're not servicing a room for many, many days, the numbers are also pointing to the fact that when they do finally do the service at the end of a stay, it's a lot more laborious, and it's actually taking a lot longer if they had done some touch-ups along the way. So how to fold in those protocols that are, and those processes ensuring that you're maintaining that distance, which I think has been probably the first and foremost, and then that just thorough cleaning is being done in the rooms more than anything else, has been a big focus for the hotels that we've seen.
Yeah, and so, you know, the idea of a safer and seamless environment in hospitality isn't just about the actual guests. You know, there's a staff component as well. And you made a comment in the past calling this new world a much more hostile place for those working in hospitality. Can you elaborate a little on what you mean by that and what hotels need to keep in mind about keeping their staff safe?
So I think maybe the hostile is a bit more from the angle that that the guest interaction is changing, right? And especially as we move from maybe the more contactless way to interact with guests and not having that face-to-face guest interaction as much that we're used to. Sometimes that's perceived as maybe more sterile. And well, we hope things are sterile in the hotels, especially now with COVID, maybe in the sense of less guest interactions being perceived as a bit more sterile. So I think the hotels are trying to strike, and they're finding this balance of how to create interactions or delight the guests, but not relying on just the face-to-face way of interacting to give this sense of a cold and hostile environment. And so that how they communicate is key. Not all that communication has to be face-to-face, but back to that chat interaction. If someone chats with you and you can chat right back and delight and answer their questions versus just not respond, you know, that's that hostile or inefficient interaction with technology.
Yeah, you certainly don't want to lose that human touch, which is, you know, one of the major perks of traveling is to have that interaction and to have hospitality workers, you know, greet you, give you things, you know, it's all part of it. And it's kind of hard to balance those two when you are also trying to be as safe as possible. So. Right. Do you have any examples of hospitality brands doing a particularly good job at keeping things safe and seamless while also keeping their service up to standards?
Yeah, there's been quite a few, you know, and I think this automation is not cold, right? And this is where that balance is really important. That the automation should help. If you request something, it should happen. And I think we've seen, you know, Hilton did a really good job right out of the gate. And this is, you know, back 12 months ago, they partnered with some others. Some of the big brands brought in, you know, outside parties, third parties to verify what they were doing, especially in the age when we were trying to still figure that out. I think they did a really good job. And beyond the brands, I think what we have seen, especially in the US, has been the resorts. I would say like resorts in general, not necessarily brands here, but in general, they have been having better occupancy. And they have been experimenting around how to service the guest in different ways and in better ways, because that is where you know, people are looking for that escape, but looking for that safe escape. I think, and I mentioned the stay over cleans. You know, what we've seen globally is that you know, the U.S. was quick to reduce, you know, some of the services. Globally, we haven't seen that as much. So they're finding how to strike that balance, realizing that how they service a guest is still really critical, and how they can ensure this automation does what it's supposed to do, helps with audit tracing, but also is really delighting the guest more. And you know, if you think about it, you know, and some of the things that the hotels are talking about and thinking about is, you know, if if a guest is still in a room and they're still getting ready for the morning, instead of getting that knock on the door, housekeeping, are you still there? Maybe a guest can see when their housekeeper is coming and they can snooze that clean. Or if they're down by the pool and they need to pop up to the room, they could see that actually their room is being serviced, so they're going to stay a bit longer and have a drink. And these are some of the great things that the resort properties are thinking of, and as we think about how things work, and I think are probably leading the way on some of those guest interactions, just because people are looking to stay at the properties and interact and use the services as much as possible in these times.
Great. If you hear a background noise, they're doing construction on my building, so apologies to the audience. So how should hotels go about communicating this, the seamless and safeless contactless measures that they're taking? How can they communicate that to guests through each part of their journey, in the booking phase, when they're checking in, when they're in stay? And, if there is an intermediary in that process, what responsibility do they have to communicate? How are they sort of getting this messaging out there in an effective way? Yeah.
I think the intermediary has always been a bit of a struggle, even the best of times. So when these more ad hoc situations come up of additional information, sometimes we struggle in how to communicate that. And I think these are the times that over communication is absolutely key. So any problems that existed in kind of the status quo only continue to get highlighted. So how a hotel communicates on property, even in the room, some hotels really look to remove flyers and paper, anything tactile in the room. I think we need to think about how we add some of that stuff back, on their website, and in any way they can, because as these protocols change and even the hotels are sometimes experimenting with what to add, what to offer. Some sorts of services are guest request only. It isn't clear. So they can't just rely on their website to outline that. They need to do this in multiple ways.
Great. And then I want to turn a bit to how hotels are working with other stakeholders, such as airlines or governments, which we heard a lot about from Gloria and Alan. Where do hotels fit in that mix, and to ensure they're complying with other measures that are being taken across the travel ecosystem?
Wow, I was listening to that earlier. The airlines have a tough challenge, and especially with how to implement any regulation that's coming down. I think we're still, from the hotel angle, still trying to figure this out. In some countries, hotels are being used as even quarantine hotels. That seems to be a bit more standard in terms of how they're going to interact with the government, how they're going to interact with the airlines, and how they're going to ensure very strict governmental protocols are being followed. Beyond that, we are seeing probably less interaction in more in other parts of the world. The hotels are trying to implement the processes and the procedures that they legally and from potentially brand standard need and want to implement, but how that then gets communicated with an airline or with governments, we haven't seen any sort of standard way to do this yet.
We've got time for a couple more questions here. I wondered if you could talk a bit on the importance of staff training and aligning that perhaps with a company culture, the hotel's culture, and how can that element help implement these new safer and seamless practices?
Yeah, as I mentioned, in the best of times, training has always been absolutely key, because you have high staff turnover, and in these times that is certainly no different. Even more difficult. So how you make your onboarding with staff how you can onboard them to a solution that's as easy to use as possible. We have to think of who our users are in this case. A lot of times in the operational field, these are not tech savvy users. So that ease of use is absolutely critical. Video snippets to how they use the system, big numbers, big buttons, very clear, very clear. And I think that onboarding, when you look at technology, when you look at solutions, how well it helps you day in and day out is clearly critical. But how easy is that onboarding, and how insightful and supported is that solution afterwards? And those are equally critical. And so we at Opti have done a tremendous amount of effort to make remote onboarding seamless, to make training snippets as easy as possible, to be in constant communication with the people on the ground to ensure that everyone is up and running. And I think, we're going to see that across the solutions, and we stress that, and back to your question about IT solutions and which ones to implement, a hotel needs to equally look at onboarding and ease of use out of the box, but the support that they're going to get as well, before they jump into any of these potentially new solutions that are on the market.
All right, so I want to wrap this up with changing gears again a bit to your investor hat, if we could. For startups, where are there opportunities in the hospitality market right now?
It is a challenge out there, and I think where can you add value? It is for new ideas. A lot of the hotels are delaying buying decisions. Are you able to offer something that allows them to save time and save money? I think this is absolutely first and foremost. But beyond that, I think the bigger advice to some of these startups is how they're funding and how they're making it through the next 12 months. So beyond the idea and understanding your target market and understanding your product market fit, the timing has become immensely unpredictable. So there's just buying decisions that are being potentially delayed or becoming more complicated. So think about, how can you make it through these next 12 months in terms of funding? A lot of investors are, let's say, doubling down or really protecting their current portfolio. So they're not investing necessarily in a lot of new ones, or if they are, they're looking for that bargain. So beyond that, and being convinced that your idea is the right one, the timing is just so complicated right now. So just think about how you can navigate through these next, I think, really 12 months.
All right, we are at time for this today, but Catherine, thank you again so much for joining us. Really appreciate it. And we'll hand it back over to Kevin.
Thank you.
And now for the medical view, what to do to make travel safe, featuring Florian Kramer, professor of vaccinology at the Icahn School of Medicine at Mount Sinai, interviewed by Kevin May, our editor-in-chief of PhocusWire.
Hi, Florian. Nice to see you again. We spoke a couple of weeks ago. Thank you so much for joining us on PhocusWire Pulse today. We really appreciate your time. I think you're there in your scrub, so you're probably in the middle of something there at Mount Sinai. We've always been very keen at PhocusWire to bring in voices, as we call them, from the outside of the industry. And I think the example of having you talk to us today is the best example that we can think of, because you're at the center of so many things that are going on around vaccinations and antibody testing, and we're going to get into that in a moment. But I spoke to your colleague Dr. Eric Liam in December for our New Reality With series, and we touched on a number of things. But we're now 3 months on since my discussion with Eric. So, Professor Florian, can you give us a sense of where we are now, as I said, 3 months on with regards to vaccinations, antibody testing, which is something that you're obviously very passionate about, in the context of it's actually been a fairly busy 3 months in the world of vaccinations? I mean, and certainly the government here in the UK is incredibly proud of the number of first doses that they've given to north of 15 million people. But just from your perspective, an overall kind of big picture view on where we are with things at the moment.
First of all, thanks for inviting me, Kevin. It's a pleasure to be here. A lot of things happened in the last few months. Several countries started to aggressively roll out vaccines. Of course, in my point of view, it could be even more aggressive in the US and the UK, but we see very high vaccination rates already in Israel, for example, and this continues. Of course, there are still issues with getting enough vaccine supply and with actually getting people vaccinated. But the vaccination rates are going up every day. And so this is a very, very positive development. And we, of course, see first real life consequences of that. Recent reports from Israel, but also from the UK, show that the vaccines, even when they're used in the population outside of a clinical trial, work very well. And I think this is a very good sign. What we also see is globally right now, the cases of SARS-CoV-2 infections are going down. It's not completely clear why this is happening, and it's not the same scenario and same situation in each and every country, but this is also a good sign. But of course, you've all heard about these variants that started to emerge. And they make life a little bit more complicated because they seem to be a little bit more infectious than the garden variety SARS coronavirus 2. And some of them might actually reduce vaccine effectiveness. That doesn't mean that the vaccines don't work, but in some cases, the vaccines might not work as well as they work against garden variety SARS coronavirus 2.
Thank you. Can you just talk us through what you actually do and your kind of work around antibody testing, which is kind of what Eric and I spoke about back in December, because it is certainly from his perspective, and I believe from your perspective, a vital component of getting the travel industry moving again in a safe way.
Yes, of course. So we were one of the first labs globally that developed tests to find out if people already had immunity to SARS coronavirus 2. And we're very interested in figuring out what actually protects people from infection, right? And so our studies, but also a number of large studies that came out in the last few weeks and months suggest that if you had already a SARS coronavirus 2 infection and you make antibodies, you're seropositive, your risk of getting another infection is very, very small. And I'm saying that this, although I know that there are media reports about reinfections, but these reinfections are very rare. Several studies have now shown that having antibodies to SARS coronavirus 2 from a previous infection can actually protect you better from getting infected than vaccination. And so we're getting pretty good data that suggests if people have antibodies, they have a very, very low risk of getting infected again.
Is there any data yet or research that you're aware of that speaks to how long antibodies are protecting people for? Or is it too early to say?
Well, it's always too early to tell if you want to talk about years. And, you know, after 5 years, we'll probably want another 5 years of data. But it doesn't seem like this immunity just goes away after a few weeks. So these antibody levels usually go up very high after infection. Then they come down a little bit, and then they usually stabilize. That's how the immune system works. And so we see almost after a year now that people still have plenty of antibodies. And so I would not expect that the protection is disappearing within a year. Of course, the longer you wait, the more likely it becomes that somebody has a reinfection. But even then, the reinfection is probably mild or asymptomatic. But I'm more talking about many years and not months.
And forgive my lack of knowledge about vaccines and antibodies here. I'm sure you will. But is there any difference at all between the antibodies that people get from a vaccination to the antibodies that they get from actually having the virus, or is it exactly the same thing?
No, it's different. So if you get infected, you make antibodies, but the level, so how much antibody you make, may be very different from one person to another. What we see with the vaccines is that if you get 2 shots, for example, of the RNA vaccines, everybody makes very high titers of antibodies. And so that's also why it's recommended that people who already had an infection still get vaccinated, just to get these very high, very homogeneous antibody titers. But the mechanism is the same. So these antibodies, these are small proteins that circulate in our bloodstream. They bind to the virus and they prevent that the virus then can bind to our cells and infect us. And that's the mechanism. So if you have them, that's very good. And if you have more of them, that's even better.
So let's start connecting all this to what we do, which is write about the travel industry. And as you would have heard in the previous sessions, getting the travel industry moving again, some form of recovery in a safer and seamless way. I mean, what do you think? And this goes to the title of the session. I mean, what do you think are some of the core elements that need to be put in place to make travel safe again? We've heard some different examples so far, but from your as a man of medicine, what is your perspective?
Well, of course, first of all, testing for virus is one, for active infections is one of the aspects here, right? So if you board a plane and you know that everybody on the plane has been tested for the virus and everybody who is on the plane is negative, that gives you a very, very good feeling about it. And I think testing for viral replication or for infection is a big component. And some airlines, for example, do that in some countries. In other places, that's not so common. And then there's the question about immunity, right? If you have a population of people who have antibodies, who have been vaccinated, who had an infection at some point, it's very hard for the virus to spread within that community. So if you take the cruise ship example that we had in the beginning of last year, if nobody has immunity on a cruise ship, the death rates are very high, meaning a lot of people get infected if the virus is on board of that ship. Now, if everybody on that ship would have immunity, even if somebody gets an asymptomatic infection and comes on board, the virus would have a very hard time to spread, and very likely nobody would get sick. So you would create a very, very safe environment and an environment of very low risk for people on that cruise ship if everybody would be vaccinated or would have antibodies. And so I think there's many examples where you could implement either nucleic acid testing, so basically testing for infectious virus, or looking at immunity and then basically create spaces that are really safe.
Just talk to us briefly, if you can, Florian, about the differences, I beg your pardon, in types of tests, because some are deemed to be more effective than others. There is one that comes back incredibly quickly, but it may not be as accurate. So that's in a world of travel, which is very much about speed of boarding and all those kind of things, and rushing people through airports and all that kind of stuff. There's a bit of a dilemma there, isn't there?
Yeah, that's true. And in general, the quicker it comes back, the less reliable it is, right? But antigen tests have been proven to be a relatively good indication for if somebody is infectious or not. And those are these quick tests that you can do within a few minutes, basically. So you take a nasal swab, and that can be done with a quick test, and you just look for viral antigen. And usually those correlate very well with infectious virus being present, right? So somebody might still have a little bit of virus, but not enough to actually culture the virus or infect somebody else. So I think these quick tests do have a place, and it's much better to use them than not to test at all. But of course, nucleic acid-based tests like PCR for detecting virus are much more sensitive, but they take time. And usually you get the results after 24, 48 hours. And of course, that's very impractical.
Please go ahead.
For the antibody tests, it's very similar. Usually, you need a blood sample for that. You need a serum sample. That doesn't have to be a regular blood draw. It can be a finger prick. But again, it takes some time until you get those results if you do it with a proper test. There are also quick tests where you can figure out very, very rapidly if somebody has antibodies or not, but those are usually also less reliable.
So going back to the comment I made at the beginning of the question, you know, these are scenarios based on testing that require whether it happens when people arrive at the airport and they check in, or in the example of a cruise ship when they're at the port, or if you want a more reliable one, you do it 24 hours before. That completely messes with, as I said, you know, the procedures that we go through as travelers, whether it's checking in or whatever. I mean, how does a cruise ship or an airline or an airport or you know, Homeland Security or in the US or whoever's responsible for it, how do they kind of, if you have some thoughts on how do they manage that, given we want reliability, but we also don't want hundreds of passengers turning up for a flight on a massive A380 aircraft and all crammed in somewhere getting tested?
Well, it kind of depends if it's now testing for active virus or if it's testing for immunity. Because testing for virus is something that needs to happen relatively close to travel, for example, because if I'm negative 3 weeks, if I was negative 3 weeks ago, I can be positive today, right? So you want a smaller window, but you could, for example, communicate that people have to get a test within 72 hours of traveling. And when they come to the airport, they have to show that they are PCR negative, and then you allow them to board the plane, right? And this has actually been done by, I know personally, for example, that KLM used to do that in Europe for some time. But with the antibody test, it's a little bit easier because you could provide a certificate that you're vaccinated. And if you get vaccinated in the US, you get these little cards from the CDC that actually indicate when you were vaccinated. Or if you do an antibody test, the antibodies don't go away, and you could do that test now and then travel in 5 months, and you would probably still be able to travel with that test. So I think these are different scenarios. For looking for infectious virus, you need to do the test right before you travel. If you're looking for immunity, you can basically do the test whenever it's possible and then travel much later, right?
Okay, so we've talked about the transportation part of all this, but you know, a large swathe of the industry is also where you actually sleep at night. So it's a different scenario. You mentioned scenarios just then. It's a different scenario when we talk about hotels and private accommodation and things like that. I mean, how do you think that the providers of those should be tackling this issue in the same way that airports, airlines, and cruise lines, for example, are thinking about tackling this?
I mean, you could actually tackle it in the same way and create a safe space in a certain hotel where, you know, everybody who checks in actually has immunity, for example, right? That's one possibility. You could also take a halfway solution and make sure that all your hotel staff is vaccinated, and that at least makes sure that they don't transmit virus among each other and to the guests, and that they don't get infected by the guests, right? So I think that would be an interesting step. In terms of infectious virus, it's much harder, right? In a hotel setting, you might have a lot of people. It's a more dynamic situation. People are coming in all the time. In a resort, people might stay in that resort, so that's easier to manage. But if you think about the hotel in a city, people leave and they go shopping and they go sightseeing and then they come back. So they have many interactions, right? And it's really hard to keep that under control with with infectious virus. But again, if you're running a resort hotel somewhere where people in general stay in that hotel, it's easier to manage, because you arrive there with a negative test. You might actually take another test on the day of arrival, and then you should be okay, and everybody should be safe. But again, it depends on the situation.
Another area of the industry that we talk a lot about is the stuff that people do. So tours, activities, the very reason, often, unless you're a business traveler, the very reason why you travel. So it's the experiences that you do. Is it fair to say that they are really at the extreme end of this, because it's something that travelers might do, or tourists might do, just for an hour, go and visit a museum? I mean, how do those types of organizations and providers of experiences do this? I mean, you're having a holding pen for people to be tested or provide this is not something that people often have to queue up for ages for a museum anyway, let alone having to do all these kind of things. So how does that kind of get managed, do you think?
I think it's almost impossible to implement testing there. If you think about a museum, I think the only thing that can be done is to make sure that there's enough space between people, that there's enough airflow in these facilities, and that people are wearing masks. I think that's the only thing you can do. But there are other activities that might be outside, and I'm thinking about all kinds of sports activities that are very, very safe just because they are outside. And that's in general a rule. As long as you're outside, the chances that you get infected are much lower, because there's so much air movement that you don't get easily exposed to that much virus. All inside activities are potentially much more dangerous. But again, many of these things might be manageable with leaving enough space, having enough airflow, and enforcing wearing masks.
We're coming up towards our end of our time here, Florian. I mean, you heard me discussing with Gloria from WTTC about coordination between governments and the industry. What's your kind of perspective, if any, around the work that you do and how that's coordinated with maybe the CDC in the US and EU bodies and things like that? Do you have an opinion on whether you think that's happening efficiently and effectively at the moment?
Well, efficiently and effectively, that's a question. But of course, policymakers and the CDC and also European regulators, they look at the data that's out there and they make decisions based on that data. And if enough data accumulates, they change policy, right? There are in several countries policies in place that restrict people who already had infections less than people who never had a SARS-CoV-2 infection, just because the risk is lower that these people carry the virus and spread it, right? So I think policymaking is always a little bit slower than the science that informs it, but I think we'll see changes in the next few months, also based on vaccine rollout and so on and so forth. And I think Israel is always a place to look at and to see what they are doing, because they are far ahead of the curve, and they might start to implement changes that then a few months later might also apply to the UK or to the US or the European Union.
Apologies, I'm massively overexposed here because it's unusually sunny here for February in the UK, so apologies for that. But I said this to your colleague Eric in December, and I don't say this to very many people in the industry. Just to thank you for all the work that you do, and best of luck for everything else that materializes for you over the rest of this year. And thanks ever so much, Professor Florian Krammer from Mount Sinai Medical Center, for joining us on PhocusWire Pulse Day. Thank you very much.
Thanks for having me.
Up next, one app to help them all, bringing tech to the fore in a recovery, featuring Clive Bork, president of EMEA and APAC of Down, interviewed by Mitra Sorrells, senior reporter of PhocusWire.
Well, thank you so much, Kevin and Florian. It's certainly very helpful to hear the science behind all of this. And welcome, Clive Burke. You are with Dayon, which at least for now, I suppose, is best known as the maker of the Verifly Health app. Clive, thanks for joining us.
Thanks very much for having us. Appreciate it.
So I know Verifly is currently being used or about to be used by American Airlines, Alaska Airlines, British Airways, probably some others. What are you learning from these initial implementations, and what still needs to be fixed?
We're actually learning a lot, and there's still quite a lot of work to do. So, in some ways, where we are is American are using us for all international flights. British Airways are using us for flights into the UK and flights into the US. Alaska are coming on stream, and there's quite a number of airlines in the queue who are coming live in the next month or so. So there's a lot going on. What we're seeing is levels of interest that spans the globe. So from Japan to Australia to Africa and across the US and so on. One of the key lessons that we're learned is that, and this is not something we can necessarily fix immediately, is passengers are pretty frustrated by the processes themselves. And as you know, the processes have been tightened up by a number of governments in recent weeks. So all we can do for now is implement public policy and implement it as quickly as possible in an agile fashion as close to the time that it comes live. But what it's clear is that the policies that are in place today will probably and hopefully will get dialed back. And that'll be necessary for passengers to say, more and more passengers to say, we're willing to travel again. So that just simply the processes have gotten so complex now that it creates a kind of it creates an impediment to travel, but also creates a somewhat of a fear factor. The same way before, where if you had complex visa requirements to travel somewhere, it would, even if you applied for the visa successfully, you'd still be a little bit trepidatious before you arrived, whether you get into that place and so on. So that's one thing that we've learned. Another thing that we learned is the readiness to, and Alan talked about it quite well earlier, the digital proof of vaccine credential, the readiness of the different public sectors or governments around the world for that. The European Commission, for example, surveyed the member states and got a mixed results around readiness to provide APIs. I mean, everybody has a plan, but when they'll be ready. And those will be needed if, and we're not saying that vaccination credentials will be needed for travel. COVID tests we know will be needed for travel, but not saying that vaccinations will be. But if they are required, it would be much better if there is those digital proof of credential available to any of the health passes, not just the Verifly app itself. Another thing that we've learned from passengers as well is that they don't just want an app that gets them through the airline aspects of the airport. They want to be able to, as was discussed by Alan and others earlier, they want to get through some of the other choke points. And so we need this credential to actually enable people, whether it's their biometric and their phone and their identity wallet or both, to get through the friction points like bag drop, or how about even enabling payments within the airport, or going from curbside, or in our vision, go from home to home or home to hotel, that you can satisfy all of that. So there's actually quite a few learnings along the way. And the last one, and I'll stop talking, it's a big question though, so there's a conversation about apps and passes, but actually, and then others are having conversation about SDKs and linking into the airline apps. But it's more than that. So sometimes you need the standalone app just to be agile to implement government policies because it's changing so quickly. Other times you want to be able to integrate into the airline app so you can have one app at the check-in or at the boarding gate so that all the status can be showed according to it. Other times you want an API because all you want is someone to be able to pull the data from the health pass after it's been processed, just the status to say someone has been cleared, they've done their attestation, they've got their negative COVID test and so on, that all of that can be passed as a flag in so someone can remotely check in. So it's from our perspective with Verifly, we feel that all of those requirements are required. And then finally, not everybody can persuade their passengers to download an app. Like in some geographies, an app is heavy, it then affects the data. The passengers have to pay for that data download, the data transfer rates are lower. So, and also the penetration, or let's say the adoption of their airline app within some passenger bases is really low. So you need to have some sort of web interface. So like it's a browser based, or I get to a web page and I can process from there. It's not necessarily all contained in that. So anyway, that's the lessons that we're learning, and that's lessons learned from the operations we have today.
So that's a lot there that now needs to be addressed. Yeah, no, so you've given us a lot to think about. So the way it stands right now, the Verifly app is a standalone app, correct?
standalone app with an API, and soon to have an option for an SDK as well. So.
Okay, so then I guess you referenced some of Alan's comments there related to the airline apps. Do you see eventually the best solution that it would be housed within the travel brand app, whether that's the airline, the hotel, whatever it might be?
I think that it will be a good solution for some travelers for some scenarios. I think a standalone app will be a better solution for other travelers who are saying, I actually want to be able to pay with this, and I want to be able to book my taxi with this or my ground transportation, and I want to be able to check into a hotel. So in which case, the airline app may not be the logical place for it. But at the same time, the airline app may need to know about it for those travelers who prefer to use that. Back to my point about you can coexist. You can have some travelers traveling on that flight, members of the Verifly service, where the data has been surfaced through the airline app. Others, data has been surfaced through some web functionality. Others where they have a standalone app. That's how I look at it.
And what about this question? Alan again made the comment that he sees standards as more important than this question of interoperability. We seem to be hearing about those two things in tandem. What's your take on that?
My take is similar in the sense that I don't see the passes like app to app talking to each other, but I do see behind that the identity being interoperable. So in Verifly, the identity data is stored on the user's device. It's released by the user with their permission. It's really their credentials secured by them on their device, using the same security that we implement in our business for access to bank accounts or approving payments and so on. So at that level, around the identity data, that has to be interoperable. So if I'm going to release that information to a hotel and go release it to an airline, there has to be standards around that, rather than standards around the Verifly Pass app talking to the IATA Pass, for example. So I agree that maybe at that level, that's not needed. Then as you dig deeper into the process, then you do need standards for common ways to handle these things, common views on privacy and security. Most of us are looking at it around the user controls their identity, and that's a really good way to look at it, which then brings in that conversation about privacy we were having earlier. We're saying, actually, we'll come out of this with a better outcome on privacy. Because yes, it is the same data and we were sharing it already today, but now we're moving some of that under the user's control so they can decide who they're going to share it with. And if they don't want to be part of the, let's say, the partnership framework of some app, they can just say, I only release my data for the purpose of my travel. I just want to get through the airport, that type of stuff.
And what about, Gloria made the distinction between a health passport that stores potentially all of someone's health records, as she described it, versus a health pass that is a bit more of a one-time use.
I see them very different. So there is a separate people out there, separate to what you see with Verifly or some, talking about health apps, and those health apps can go broader. And possibly due to COVID, we'll all have a heightened awareness and desire for those things, and that will be again done with the user's consent and permission and stuff like that. And I also see the passes that might unlock the internal economy is very different to someone traveling. With travel, what I need is I need to be able to get through the airport. I need to be able to prove my COVID status. I need to be able to do the attestations that are required. I need to be able to check into hotels and stuff like that. I need to be able to go. That pass, that's what we need. That's what Verifly is aimed at, right? A health pass is like all my other requirements. So I think they're very different in some sense.
Okay. And did you say, so are you talking with sectors beyond airlines right now? I mean, where does that stand? Cruise lines, hotels?
We are definitely talking to cruise lines and hotels, but staying within the travel focus. So within the travel focus, we're talking to some big brand hotel chains about how this can enable check-in, how it can enable self-check-in. So really, when you arrive at the hotel, you're just picking up your room key. I mean, long-term, it might change to how do you get straight to the door of your hotel room and so on. Also, cruise lines, they're struggling to get back. In the same way with airlines, how do they get back in business? And therefore, a significant aspect of that is how do you verify the status of the COVID status and any other declarations the passenger may need if they're traveling around the world. And remember, it's not just submitting my COVID test. Every country has these forms that you need to fill out. So in our app, what we're doing is we have this forms capability in Verifly that we can quickly configure those forms to reflect the public sector requirements of the day. And they are changing, as you know, on maybe not a weekly basis, but every 2 weeks and so on. Right. So there's other things that the passenger has to do, and we're taking that paperwork out of there, removing the need for them to do that on paper and doing it within the app or within the application.
So I know that Dayon recently signed on with the Good Health Pass Collaborative. Can you tell us a bit more about that and why it's important and what that might mean as far as next steps?
Yeah, well, one thing that we thought about that was we saw partners of ours like MasterCard working on it, and they came to us and said, we think this is interesting. We found that, we do need, as a group, as an industry, across all the stakeholders, to collaborate as much as possible in order to get the economies back, get the travel back, get us all moving again. And not everybody's going to be able to address all the requirements. So one thing that we liked about their approach was inclusivity. So they were saying, we're not going to dictate a single app or solution for everybody. There should be choice, which is something we espouse. There should be choice for government, there should be choice for airlines, and there should be choice for users, which direction they take and how they go. So that's quite important. And that was one of the key principles that the Good Health Pass is espousing. So we like that. Also in terms of inclusivity. So one of their principles is that this is something that should work for everybody all around the world. And again, if I talked earlier about the interest we're getting from Africa, from Japan, from the US, UK, and so on, this has to be an inclusive solution. This has to be inclusive answer rather than the word solutions, wrong word, answer, really. So that's why we like the Good Health Pass initiative.
So let's talk about that topic of inclusivity really in two angles. First of all, related to the different strategies and solutions that you're seeing develop around the globe. Are you seeing differences or are you seeing more of a cohesive mindset and strategy?
Definitely seeing differences still. So some are coming at it from the health perspective, like we talked about earlier, saying we're really specialists in health data or tests or whatever, and they're extending them to say we can take that into travel. Then there's others who are saying we're in the travel business, so we're going to take it from a ticketing, boarding pass perspective and extending that into the health pass. And then there's people like ourselves coming from an identity perspective, and that's what our expertise is in. And we've been doing that 20 years, and then we took that to develop Verify. So that's where the differences are lying from. There are some very common principles. Hopefully most people are adhering to the users in control of their data, the data stored on their device. Obviously, you need to store some data within the service to be compliant with the airline and the carrier requirement, the airline partners requirements, and the government requirements. For example, you have to store the US Center for Disease Control Attestation for 2 years. So there's a requirement to store that for a number of years and so on. So those sort of things have to be addressed.
And then what about related to the question of inclusivity? What about the people that maybe don't have a smartphone or aren't comfortable?
It's a super question, and it is really important. And again, what we're trying to say to our partners is design process that includes everybody, and don't make one, let's say the smartphone one, the more convenient one, and the others the less convenient one. So for example, you should be able to, and we see this as a future capability, you should be able to complete the whole process through a browser. So let's say you complete it through a browser at home, you don't have a smartphone, but you have a computer, you've used that for check-in, or you've used that to buy your ticket, or someone has access to that, can you help you with that? So then you should be able to do your COVID declarations and upload your COVID test results and have all that processed before you come to the airport. And then there'll be a flag in the Verify service that when you go to check in, they can say, oh, that passenger, Clive, has already completed the process. Or even it'll appear on his boarding pass. So that person doesn't really need to have their smartphone at the airport and so on, or to have a smartphone at all. So that's one way to deal with that.
This question was asked earlier, I believe, of Alan. Do you believe that we will start to see some fundamental changes in the layout and processes at airports? Will we have temperature kiosks throughout a facility, virus kiosks, that sort of thing?
We definitely see changes in the airports coming. And as you know, we have some big airport partners and customers as well, like Denver Airport, who signed on for Verify last year. And some of those forward-leaning airports like Denver and others, they're all talking about the fact that the airports will need to change. Some of them talked about the fact that they had some of those ideas in mind, but there wasn't really a strong commercial driver to make these changes happen. And now with COVID, it's being enforced. As an example, in Denver, you have a Verify lane that a vulnerable passenger group can actually say, I want to go through those lanes. I want to reserve a time slot in security. So there's a 15-minute window. So I don't have to go through in a crowd. I can decide to go through at a period where I know exactly how many people will be going through, spaced out. I can go through go into a dedicated train carriage within the airport to move between terminals. And that's one example of an airport changing. But there are other examples as well. Like some airports are talking to us saying, because of social distancing requirements, we now need to use all the airport security lanes for passengers. So previously we were using them for crew and for staff. We need to move those to a different location in the airport. If we do that, we still need to find a way to make sure we securely transfer them airside. So we need to bind the identity of the person that went through that remote screening somewhere else to when they come airside. So those are the sort of changes we see as well. Also, I see a lot more contactless within airports. And contactless can be achieved in two ways. One is you can use your device and scan it in the wallet on your device, or you can simply look at a camera and use your face to authenticate or verify yourself. And a combination of both is probably going to be the answer. And that means we can streamline some of the choke points through the airport. We can actually make it a richer experience as well. Could you imagine if you could pay for stuff in the retail environment at the airport by simply looking at a camera? So I don't have to hand over my boarding pass because it's resolved my identity. It knows what my boarding pass is. I don't have to hand over my card. I don't have to tap the keys if it's not contactless and so on. So you can make a purely contactless experience for the retail environment using biometrics and smart devices and so on. So there's a lot of changes coming in airports, I would say.
So I was actually going to ask that question because I know, as you referenced, Dayon has more than 20 years of experience in biometric identity solutions with facial recognition, voice recognition, that sort of thing. So can you just build on that a bit more about how that biometric technology can facilitate that seamless travel experience, as we're talking about safer and seamless today?
For sure. So for example, if you've done a remote check-in and you get to the airport and you want to do a bag drop, you could go up to the bag drop machine and drop your bag, look at a camera, scan your phone, and it would do facial recognition to bind your identity to the identity on your phone, link that to your bag, and then you can actually do the bag drop yourself. So now I've done the bag drop in a really secure way, but that bag is bound to my identity just using biometrics. And that's one example of what you might do. You could be going through a fast track lane in the airport where instead of having someone check that you're eligible to come through fast track, or you can just walk through and use your face to verify because you've pre-booked your fast track lane and so on. Those are some examples of what you might do.
Do you, as we're getting close to the end of our time here, I'm just curious, do you think solutions such as that are maybe a bit on the back burner now as people are really focused on these COVID-related solutions, or do you see things still developing rapidly in those areas?
They're definitely developing rapidly in those areas. Right now, obviously, with 10% or 5% occupancy of airplanes in some markets, of course, people are just focused on getting people back on planes. But other airports are saying, when people come back, we just need to be able to get them through faster, and we need to get away from the crowds we experienced before. People are going to be very conscious about being in crowds in future, so these solutions are really important. So definitely getting a lot of interest in that area.
Yeah, and I guess that would be my final question then, of what do you see really sticking around once, we can say that maybe we are beyond this COVID crisis? These digital health passports, for example, you think that's a permanent feature?
It's really hard to say. I think you'll always need to have a health status as a traveler in future, given what we've just learned as a globe. But whether that health status could be managed in the same way as your visa status, things could well be, a better way for the traveler, better for the airline, better for the governments, and so on. But the health status will still need to be transferred with you, whether that's within a wallet on your phone, whether that's linked to your travel documents or some other way. And remember, we're going to have to do this for domestic travel as well as for international travel, because there's quite a bit of domestic travel over long distance as well, and free movement within the Schengen area and so on. So there's a lot of things to consider there. So I believe that some form of health status is going to be here for the forever, basically.
Okay. Well, thank you so much, Clive, for sharing your insights. We appreciate your time.
Thank you very much as well. Thank you for the questions.
And now I'd like to turn it over to my colleague, Linda, for our next session.
Up next, Business Travel's Twin Dilemma, Recovery and Safety, featuring Brandon Balcom, Senior Director at CWT, interviewed by Linda Fox, the Senior Reporter at PhocusWire, should I say.
Hi, Brandon.
Hi, Linda. Nice to see you again.
quick thanks to Mitra and Clive from Day On for taking us through some of the tech developments and current challenges. So let's leap right in here. What are your top corporates saying right now about their concerns about getting back on the road?
Yeah, so, there's a lot of requests coming from the corporates to us because there's so much chaos and, a disintermediation of information amongst them. So they're trying to make sense of where is it safe to go, when is it safe, and how can we support them with providing that information so that they can make those better and more informed decisions. They're also asking, for a lot more policy controls. And interestingly, in terms of all the conversations we've had today about new technologies and so forth, we are also being asked sometimes to pull back and implement more analog services, such as those with, travel counselors on the phone talking to travelers and advising them through. And that, again, I think has to do with disparate information sources and travelers trying to make those decisions.
Certainly, we seem to be hearing that there's this acceleration on the digital side, but we're also hearing that, people may well go back to their travel agent. How do you see that kind of being balanced?
Yeah, so like I said, right now, there's more policy control in place. There are more purposeful, checkpoints before a company says, yes, it's okay for a traveler to go somewhere on a business trip. And so then the need for that travel counselor, that they can ask questions, have better contacts, but also manage that policy in real time and make some of those, helpful guidances for travelers. So we have to focus on providing those travel counselors with the right tools and access to information so that they can then forward that on, in their conversation with the traveler.
So one of the things you mentioned just there was the sort of difficulty of all the different pieces of information coming from all different directions. Do you see a need for a sort of single source of truth? And would that ever be a possibility?
I mean, that is the real goal for sure. Single source of truth, everybody's looking for it. Right now, we look a lot to governments, and then we look at layers and new, aggregation of data into, what we assemble to be a single source of truth, or many single sources of truth compiled into one. And then it's important that we have easy capability for the individual to go into that platform and access the information that's very specific to them, to their needs, to their upcoming travel. And, that's no easy task. There are examples, I think, of good single sources of truth like Thematic, provided by IATA. We use another solution as well that we're providing to customers of CBT, provided by a company called Sherpa. That's, again, aggregating different government resources, different health department resources from both state, local governments, as well as federal governments. So you're having to bring all these sources together and then allow somebody to access them in a meaningful way for that individual. Some of the solutions, they really present you with a laundry list or, the full report of everything you might need to know. And that's good as a kind of, cover all your bases. But, if we're going to use technology well, and if we're going to service travelers and help them make well-informed decisions, we have to curate that information and make it specific to them.
So clearly health and wellness of the traveller is going to be more meaningful going forward. What's the role of technology in that, would you say?
There's a number of roles. And there's so many aspects to the travel journey to think about when it comes to the health and wellness. So there's the preparation for travel. So we've talked about that sort of now new sources and how do we put those in context at the time somebody's making decisions on a trip or a particular carrier, hotel accommodation. And then there's once they're on the road and how do we update that traveler should the situation change. So, if they're traveling in a certain country and there's an outbreak, and this is thinking farther into the future about, how do we consider health and wellness? How do we communicate with that traveler and give them information of what do they do now? Do they need to exit the country? Do they need to stay put, stay in their hotel? So there's all those aspects of just curating information, getting it delivered in a timely manner in the right context to the individual. There's all these technologies we've heard about throughout the event today about going through an airport and how biometrics get used as we're checking in and going to our destination. And then you also have more, I think, that we need to do in the prediction space so that in the business travel context, companies can make better informed policy decisions. And those policies are likely going to have to be flexible, and they're, I think, for a while going to be moving a bit. So we think about data sets that help us predict future pandemics or epidemics in a particular location. And how do I want to update my travel policy in real time? And then even if that's the extent of preventing travel to that particular location for a period of time, or extracting travelers from that location. So those things need to move and be a little bit more fluid in the future.
It's interesting that you touch on sort of predictive analytics there. So I think corporate travel was beginning to talk about that a little bit pre-pandemic and how it could be brought to play. But actually, now that everything's been turned on its head, do you have to recreate all of those data sets to get any meaningful kind of insight from it?
Well, I think there are the data sets, that are business travel specific that we've been using for quite some time. I think what's different is merging those with new sets of data, and then creating new outputs and the predictive analytics that you mentioned. So to me, it's how do we find new sources of information that's more real time, different context perhaps than what we've been looking at in the past, and more of a focus on the health and wellness aspect. And so things like in today's context, the COVID outbreaks, number of cases. So for example, we've brought those into tools so that travel managers again can be assessing what's the situation here? Do I need to make a policy change? But as we talk to companies who have been looking at health data for quite some time, maybe it's stepping outside of the traditional travel and hospitality industry and looking at other industries, and how do you incorporate that data so that it merges with the business travel data, and then you can use that to make new decisions and present new information.
And when you say other industries, perhaps other sources, what are you thinking there?
Well, even now, we look at a lot of tools are sourcing from like the University of Oxford. There's health data coming from, as we think even about these vaccine credentials, right? So how do you tap into the actual health industry information where appropriate, and how do you do that while protecting the privacy of individuals? So it's no easy task. A long time we've been considering, how payment information flows. So when you look at the financial industry, how do we do more there so that there's better information flowing as far as how travelers are operating? Sometimes you see that information being used to locate travelers based on where a credit card swipe has happened, for example.
So the travel management community is used to dealing with, legislation, corporate manslaughter, and those areas. But is there more concern now that kind of the buck stops with them, so they have to be sure to be, managing their travelers, managing their safety in an even greater way than before?
I don't think the overall calculus changes in this regard. So our clients bear a duty of care to their own employees and their travelers, right? We provide many services, tools, information sets, data technology, so forth, to our clients that they evaluate for those purposes. And we create those products in consideration of their requirements of duty to care. Now, any given customer may choose to deploy certain tools that TMC provides. They might use another third party for some other aspect. So they have to assemble all these parts and then put those in front of the traveler and build their own travel program from it. So I think there will be more expectations of what TMCs provide, the information sets that we talked about, the context again in the booking process and the support that's provided on journey with the traveler. But the overall equation, I think, has to stay the same for some time. So no, significant concern, but an awareness that still we are needing to evolve and adapt to the new reality.
So there are obviously frequent flyers out there, and they're probably often first movers with the technology. And then there are those who probably fly maybe a handful of times a year, maybe even less. So how do you strike that balance and, taking care of one group versus the other?
Yeah, well, I think we've always had to provide different options for service and access to those services. So whether somebody wants to pick up the phone and like I said earlier, speak with a travel counselor, you need to make that easy and convenient for them. But for folks that want to use more digital services, you certainly need to provide those today. I always think any good technology is one that's very easy for anybody to use, regardless of whether they're tech savvy or not. It should cater to any individual's need and provide a very smooth, frictionless experience. So, I think we have to keep on with that as our guiding principle. But, you still have services that, like I said, are more analog. And I think in the business travel context, though, you're typically going to a certain level or standard that there are many digital tools and access to your services through, like I said, apps, whether that be messaging. I think one evolution that's important to point out here is how the two start to come together more. I think that, this kind of human in the loop experience when anybody's interacting with technology is more and more important. So therefore, when we have a digital app, how do I access a human, in the context of booking or whatever it might be, so that if I have a question, I can get that human-based support as well. And then people have different situations. One moment I need something that I want to do completely self-service, and the next moment I need somebody on the phone to talk to because my situation has changed. So it's the merging of those two and how your platforms allow for your offline support to always be available through digital means.
And is there I know airlines are having to be sort of super flexible with operations right now. Does the same go for travel management companies in the sense that as travel comes back, they need to be able to sort of flex up their staffing to cope while all the time developing the digital solutions?
Yeah, absolutely. We're constantly monitoring travel trends. Actually, currently we're looking at vaccination rates and how do those vaccination rates correspond to or correlate to upticks in actual business travel, leisure travel. So there's constant forecasting and capacity planning because yes, absolutely, we're gonna have to scale up and down. And I imagine there will be sort of that accordion effect for a little bit of time, as we see case numbers fall down, and then if you see a spike, you're gonna draw back a bit. I think that's gonna be the reality.
So would you say that there are technology issues that have been put in the spotlight by the pandemic?
Well, the industry has been grappling with a lot of big issues for some time. For example, content. How do we access content and put that forward, right? So we've been talking a lot about new distribution capabilities, allow airlines better access to business travelers and better merchandising opportunities through those capabilities. But a lot of the focus so far has been in that look and book or shop and book capacity, so the upfront aspect, but not, as much attention has been paid to the servicing once those bookings are made. Now, that said, we have those capabilities through the GDSs. But when you have a, hopefully once in a lifetime event like a pandemic, and we saw the mass cancellations of flights and unused tickets and vouchers being distributed, that's where, there was definitely a lack of capability there for how do we manage all of those unused tickets? How do we make sure we have visibility to them so that corporations can assess, what was the lost value and how did they reuse that for future business travel? And so that was a big setback. But I think what it does is it puts a highlight as we plan going forward and continue to think about the new distribution capabilities. We need to make sure we're thinking about all of those aspects of servicing, just not the shop and book and purchase process.
So as we've heard in the previous session, there are many developments around health passports and the challenges around them as well. So what's the reality of something getting off the ground in a sort of timely and impactful manner?
Well, I think we heard from Dan and looking at the Verifly app, and you see, I think, really meaningful progress there and with some other solutions. But we have to point out the reality that there are different constituents in this space and different stakeholders. And as we continue to deal with kind of the plethora of apps coming at it from a different angle, we're in a race to figure out sort of what rises to a certain threshold that meets enough of the need that then the standards, I think, get built around that leading solution or a few leading solutions. The other part that sort of breaks the mold is if we have major governments, if the EU or the United States, for example, were to implement a standard or actually implement some sort of health passport to be used for the context of travel, then we would look at everybody sort of retrofitting perhaps solutions and trying to meet those needs. And then I think we would grow from there. But right now we're seeing individual states sometimes implement health pass solutions. We see countries implementing those, and we see airlines. So, earlier, as we've talked a few times today about interoperability, nobody wants to download a new app for one airline check-in and then another app for their destination, whether that be a state or national government requirement. So that every trip I need to think about two or maybe more if there's another one at the accommodation provider that I'm staying at. So I do think that interoperability is a necessity, but that means that we have to have some kind of standard to build towards, and whether that's going to be based around testing or vaccination requirements, has yet to be seen. Certainly, we have to have some space for both because there inevitably will be some portion of the population that either can't receive a vaccine or for whatever reason they don't have one. So you have to have that testing aspect too, which then means you have to have the standards around the testing, which creates a lot of complication for how that all gets built back into the apps. And then how do we actually move through our lives, in a meaningful way where this is adding some convenience? Because I think ultimately that's what we're trying to do. We're trying to remove quarantine restrictions. We're trying to ease check-in process for airlines, and we're trying to open up the industry again in as safe a way as possible. So it's going to continue that pressure that we keep moving together and work together to make good solutions for the business travelers, for the consumers, and that'll benefit the industry.
Brandon, I think we'll have to end it there. Thank you very much. So that's Brandon. He's Senior Director of Innovation, CWT. And up next, my colleague Mitra will be discussing the big sort of picture with Cherry Jones, who's founder of Travelocity and founding chairman of Kayak. And that will bring us almost full circle from where Gloria took us in this morning. So thanks again, Brandon.
Thanks, Linda.
Thank you, Linda and Brandon. And now for our closing session, we welcome Terry Jones, the founder and former CEO of Travelocity, founding chairman of Kayak, as well as an author and speaker. Terry, welcome to the inaugural PhocusWire Pulse event.
Thanks very much for having me.
So we have heard a lot of ideas related to digital health passports. As someone who has navigated various aspects of the travel industry for decades, what do you think it will take for us to get to that finish line?
Well, I think there are two things that are key. One is standards and the other is interoperability. We want these passes to interoperate so that hotels and tourist attractions don't have to have dozens of connections and hundreds of apps to be able to read them. Lesser a problem for airlines because they can probably dictate what you carry. And then standards, because people have to prove that they've had a test or vaccinated. And we want standards that are widely accepted. So for example, I've just got my second shot, and I got this crazy little piece of cardboard from the local firehouse that is not even signed. Okay, now I'm vaccinated, but how do I prove it? And I'm actually working in the state of Nevada to say, okay, how do I prove that? Because I'd love to have it on my international vaccination certificate. I can't do that today. So one of the things that I'm working with my U.S. senators and trying to work with my governor about is everybody in the U.S. and eventually around the world should be able, after they've been vaccinated, to obtain certification that they were vaccinated, something that is provable. And then on the other side, the interoperability, we're seeing things like I worked last week, a discussion with the Good Health Pass Consortium. They've gotten over 100 companies together. Commons has gotten many together, and that's great. And they're discussing how to make these things interoperable. So I think it's going to take industry and government working together to get those things done.
And so what is it that you're hearing as you're talking to people? I mean, is there a sense of urgency to try to get something created in time, let's say for the summer travel season, or, what kind of a timeline are we looking at?
Yeah, I think so. As you can see, announcements are happening every day. There are, I think, 3 cruise lines who've just announced you have to be vaccinated in order to cruise. I suspect we'll see more of that. 7 countries have announced, let's take the Seychelles, for example. The Seychelles has announced, if you are vaccinated and can prove it, you don't have to quarantine. You can really do anything. Come in, show it. And Hawaii is trying to do the same thing. The lieutenant governor is working on a program, should be ready, they hope, in May. You still have to have a negative test, but if you have a negative test and vaccinated, you're done. But you're going to have to be able to prove that.
So, and let's talk about the vaccine topic then while you're there. I mean, it's fairly controversial to a certain extent, people on both sides as to whether it's smart to require the vaccines. On the one hand, from the business side of it, whether that kind of potentially is a barrier to travel, but on the other hand, also whether it really prevents transmission and whether it should be seen as the ultimate solution, or if other, protocols
Sure.
still need to be in place even for those that are vaccinated. I'm just wondering where you stand on that.
Well, for those of us who've traveled around the world, we've had to have a vaccine identification for many years. So lots of people are used to this. I think we have people on the privacy side saying you shouldn't share this information. To me, that's bunk because it's voluntary. Nobody's stealing your information. You're deciding to share it. You don't have to. You may not get to do the same things, but you don't have to share it. There are other people who are conflating it with government takeover and forced vaccination and nanites and crazy things. That doesn't make any sense either. So I do think that, particularly around something like a cruise, which is so hard hit, and you're in this very small space, that we do know that people who are vaccinated, 95% chance they won't get the disease. So having a whole ship or a whole conference of people who are vaccinated, that seems to make a lot of sense. Now, still, people have to get tested because they could be carriers. Unfortunately, we don't have proof yet that vaccinated people aren't carriers. So it's a combination of a test and a vaccine, where you greatly reduce the chance of something happening. And to me, that makes a lot of sense. Countries are going to require this. It doesn't mean that domestically everybody has to. We all saw what happened when the government floated the trial balloon of COVID tests for everybody flying. That got shot down pretty quickly. And rightfully so, because are we going to put up borders between states? No. But to me, there are places where it makes sense. I'm going to be talking in a couple of hours to a CEO who has a massive meeting business, and he's a fan of COVID passports. I want to talk to him because as a meeting professional myself, I'm a public speaker. I want to have the discussion, could it help us get meetings back faster? Would we see 2,000 and 3,000 person meetings come back in Vegas if people felt safe and the state government felt safe in doing it? Don't know, but I think it's worthy of a discussion.
And so back to what we started talking about related to what needs to happen with those digital health passports. Where do you see, do you see that potentially living, let's say, within an airline app, or a hotel app or something? Because right now there's a lot of these individual apps being developed, and, none of us really like to download any more apps. So.
Exactly right. I think that they will, and you're already seeing that. American, for example, and Alaska, I think, are using Verifly,
Yes.
And that's getting integrated into their app. So that makes sense. Some hotels may do this, and clearly, like Hawaii has an app, and countries will have apps. One thing I think it could be interesting, and I've talked again to my U.S. senators about this. What is U.S. Customs and Border Control going to do? Because if U.S. Customs and Border Control, who now requires everyone coming into the country to be tested, including citizens, said, this is our protocol, guess what? Everybody would code to that protocol. And then all of a sudden you have interoperability. Now, it might not work in England, but President Biden issued an executive order telling the Department of State and Homeland Security and others to work together with international organizations to try to create a standard. So that's happening internationally. I think for a while, we're all going to have to do what every country does, just like we have to fill out different landing cards.
Right.
But I think we'll see them, and we are in airline apps, perhaps in hotel apps, and then others may say, well, if you want to go on my tour, I think Globus just announced they're going to require negative tests and vaccines. Just download our app when you come and use our facility. So it'll be a little bit of a Tower of Babel for a while. It'll get sorted out, just like boarding passes did.
So, you have a lot of experience building B2C brands. Thinking about it from the consumer perspective, what else is needed to build their confidence, their willingness to travel? Because all of this work on the passports and things can be happening, but ultimately it comes down to that person choosing to book a flight, take a trip, that sort of thing.
Well, that's right. And I think that, it's been interesting to watch, for example, the airlines and the hotels talk about their safety protocols and programs. Most of that has been on their websites. I think as travel begins to come back, we need broader campaigns, because people who aren't traveling aren't going to your website. Hello. So does that mean more public relations efforts, more efforts, on display ads, social media, even television, to really get this message back? Maybe that's a place that U.S. travel can be helpful, or trade associations can be helpful in getting that message out. Hey, it's safe. Here's what travel operators are doing today to really convince people that it's okay to travel. Everybody says that the first thing that's coming back is VFR, visit friends and relatives, right? So people are already doing that. But then looks like individual leisure travel will be next. And I think all brands have to use their trade associations and other vehicles to tell people what they've done and what the new world is going to be like until maybe the end of the year. And it's not going to be the same as it was this year. Maybe it will be next year, but you can travel this year.
And what about, how do we build that full picture for consumers? Because, there's so many moving parts there as you're thinking. And I'm trying to think from a personal perspective. If I'm thinking about a trip, I'm starting to wonder, what's open in the destination? What's happening at restaurants there? Is there anything for me to do? That sort of thing. It seems very piecemeal to try to
manage that. And it will be. I think, again, it's a strong role that CVBs can take. In letting that message out and telling people, hey, you've just landed in our town. Here's our website. Go here. It'll show you everything that's open or closed. I've seen airlines, who have good COVID data on what destinations are open, And I suggested to a few, why don't you combine that on your map? You know, where's a low airfare with low COVID? That's what I want to know. Where can I go? You know, where can I actually travel today and give me the price? Because I think that's what the consumer's putting together in their mind. You know, good price, low COVID, safety. How do I get them together? Well, put them on a map. Or, you know, if I'm a big destination, show me. Here's all the places that you can go, and here are the protocols. Masks aren't going away. Distancing isn't going away. We know that. But hey, Broadway shows are closed. And sorry, you know, let people know. But these things are open. Right. I think that's a role for trade associations, CVBs, and travel providers, you know, whether it's an OTA or an airline.
It's a big job in a way, you know, because things are changing so constantly, rapidly, you know, staying on top of
it's a big job, but look, you know, when we started Travelocity, people were terrified to put credit cards over the web. So what did we do? We plastered all over our site. If you're afraid of that, call this 800 number after you made your booking and we'll take the credit card. Now, we didn't mention to everybody that we were then putting their credit card in over the internet, but you know, it worked. So you have to look for the consumer barrier and say, how do I get that barrier out of the way? Most of it is communication. It isn't really changing what you're doing today. It's telling that story and saying, hey, here's how you now do this. By the way, you have to get a negative test before you go. Here's where you get one. I mean, I'm going to travel next month to Hawaii. And I had 2 test kits here. They're mail-in. Neither of them said PCR test on the outside. So I had to dig in to figure it out because you need a PCR test, not a non-PCR test. Well, that's the kind of thing you need to know. Right. And here's where you can get the right test quickly in your town so you can go. Anything I can do to reduce friction, I ought to be looking at it through the customer's eyes, as you said so rightly, and figuring out how to reduce the friction in their journey. So they'll go.
So maybe you book that ticket and then the airline says, hey, we'll give you a free test. It's coming in the mail, you know, in advance of your trip. I mean, that's one way to.
Absolutely is, or might not even have to be free. Just make it easy. There are lots of these at-home tests now that work very well.
Yeah.
You have to have it. And by the way, as soon as the test is done, we've digitally uploaded your test record. So you don't have to bother with it. Just every step of the way. Now, you know, somebody might say, hey, whoa, I don't want that. Okay, don't have to have that. You can bring your piece of paper, but you'll be in the zone 9 line, you know, if you do. I look at this like global entry. You know, you don't have to have global entry. But if you get it, or TSA pre, sure makes life easier. So I think if we approach it that way, not as a mandate, but as something to make it easy for on your trip, so you don't have to stand in a line, which you don't want to be in today. You don't want to be in a line. Make it easy. Want a COVID passport? Great. Don't want a COVID passport? Bring your piece of cardboard. Good luck to you.
And actually, as we're just talking about a test, I think Kayak just announced that if you book a trip, you get a link to get a discount on a COVID test. So those types, there's some creative solutions, I guess.
I love Kayak.
Yeah.
As you know.
I do.
So, but, I mean, that's the kind of thing to make it easy. And that's why I think that all travel companies should get behind, you know, to say, hey, everybody who gets vaccinated should get access to a digital record. So it's easy for them to travel and prove it. That's hard today. Let's make that easy. The administration's doing a good job of getting people vaccinated, but unless I can prove it, you know, for those of us who travel, didn't do me a lot of good.
So we're getting to the end of our time here, but, you know, let's just think, what have we learned in the last year, would you say, that can create some lasting improvement in the industry for many years to come? You know, one of the thoughts I had was maybe it's just the need for more consistency between countries and borders as far as communications. And there was so much confusion early on in the pandemic. Anything that comes to mind for you that can kind of be a lasting lesson from this?
Well, I think many of the things that are put in place will go away, but they need to be mothballed, as they were in Asia. Asia reacted very quickly because they've been through SARS. So they were checking temperatures, wearing masks, doing all this stuff fast. And I think the travel industry has to, if things are not needed, don't forget them. The TSA is still here, and it's been many years since 9/11. It didn't go away. So I think those things are important. I think, contactless will stay. Some of the cleaning protocols will certainly stay. And as for country cooperation, it's always difficult, but the more, if we get a long way with digital ID between countries, forced because of the pandemic, that'll make travel easier for all of us over time. More and more, using the phone is how we identify ourselves.
And I guess I would just ask as we finish up, I mean, how are you optimistic for the coming year? What is your outlook for?
Yeah, I am for leisure travel. I think business travel is going to take a long time. I'm on the boards of many companies, and CFOs are liking the fact they're saving a couple $1,000,000 a quarter in travel.
Yeah.
So I think that's going to take time. We've proven that certain things can be done digitally. So I think, if I ran an all business hotel, I'd be thinking about how else can I market it. I think the wild card is meetings, particularly large meetings. Everybody's putting off their meetings till the fourth quarter right now. So as a speaker, I'm not getting any bookings until late in the year. I'm not sure that they'll even happen late in the year unless we can convince local governments that it's safe to gather. And I think that's going to take a lot of people being vaccinated and proving, yeah, we are vaccinated, we can get together, or we've had negative tests, we can get together. And I think the industry needs to think hard about that, because people are just dreaming to say, oh, it'll all be fine in September. We got 50 state governments here and they're all operating differently. I'm not sure it will be, unless as an industry we come together and prove to them that we can do this safely.
Okay. Well, thank you so much, Terry, for your time and your insights. We'll definitely have to see how this develops over the course of the coming year. And now to close out our event. Yeah, no problem. Glad you could join us. To close out our event, I'd like to turn it over to PhocusWire Managing Director, Pete Como.
Please welcome Pete Como, Managing Director of PhocusWire.
So thank you very much, Gloria, Alan, Catherine, Florian, Clive, Brandon, and Terry, as well as the fantastic PhocusWire team of Kevin, Linda, Jill, and Mitra for some fantastic content today as the travel industry grapples with how to best facilitate a safer and seamless future. All of this content was recorded and will be available on PhocusWire, as well as our YouTube channel in the coming days. Make sure you mark your calendar for the next Pulse event, Loyalty for the Long Haul, which will take place on March 23rd. More details will become available in the coming weeks, so keep your eyes on the PhocusWire newsletter as well as on PhocusWire.com for additional details. The other new series we just launched on PhocusWire is called Future Proofing Travel, where we will interview leading executives on a weekly basis to understand what steps they are taking to not only build their businesses back toward recovery, but also put in processes to help future-proof them against the next crisis. As much as we are all becoming used to all this great streaming content, I suspect many of you are like me and cannot wait to come together physically in person. Our global conference will satisfy that requirement in mid-November from the 16th to 18th. So hoping many of you can join us in Fort Lauderdale, Hollywood, Florida in the middle of November as we come together to map out recovery. But before we get there, join us in late June for PhocusWire Europe from the 28th through the 30th, where we will uncover the opportunities that the pandemic has opened up, as well as further the discussion about the industry and how we can speed up recovery in a safer and seamless way. Thanks again.